I can say from my own experience that about a year and a half or 2 years ago, my eyesight started to deteriorate. Especially when I prepare these videos, read a lot, watch a lot of material, of course my eyes get strained. And after this, I start feeling a subtle but not intense headache. And I relieve this headache myself. And now I want to teach you how to do the same. Types of headaches are divided into 2 major categories. The first one is primary headache, and the second one is secondary headache, which has its own cause. In this video, I will only be discussing primary headaches, tension headaches, and migraines. Tension headache is the headache that patients most often come to see us with. In fact, the majority of patients who suffer from headaches experience this type. This type of pain is typically characterized by a relatively low to average level of frequency. It usually impacts the occipital region at the back of the head as well as the bilateral parietal temporal regions on both sides mainly. External stimuli do not have a significant effect on this type of pain. In modern digital age, the tension headaches occur in many people because they spend long hours working at their computers. Focusing your vision on a single point for a long time causes significant tension in the neck muscles and the muscles around the head. This tension leads to compression of head and neck blood vessels and nerve endings. As a result, pain develops. Sit up straight, place your right hand here and reach for the angle of your shoulder blade, exactly the angle of the shoulder blade. There is always some point of tension there. And you start massaging it intensely as you can. There's nothing there to worry about. No lymph nodes or nerve endings that you could damage. Just massage it. Then with your left hand, massage the left side. Then with your right hand, massage the trapezius muscles. Just press on them. It's better to push them through. Start from the neck and press through, moving towards the shoulder. Do the same on the left side. Perform these movements. It takes 2 or 3 minutes. Take both hands, place your thumbs on the occipital protuberance. You can find it at the back of your head. There is a bony bump on the occipital bone. Move down from there and you'll find a hollow, and there are muscles there. In this hollow, you need to press and massage all these muscles, starting from the center and moving outward. So you're slowly moving toward the ears, right? Move toward the ears on both the right and left sides and near the ears. There are the mastoid processes of the skull here. If confused, you can look up anatomy on the internet, everything is shown there. Right behind the mastoid processes, there are 2 very painful points. You need to press on them, not down into the neck, not like this, but right here. And it will be very painful. You need to carefully massage out all these sore and painful bumps, massage the entire area, and then you can continue the process with 3 fingers. To press here, right here, where you go down from the occipital protuberance, in this hollow, there are a lot of short occipital muscles, and they are very tense. And because they are tense, they are painful, don't be afraid to press on them. Press through the pain, and then you will feel how the blood flow to your head improves. You may even feel your vision improve, and at the end, you can finish the massage by massaging the point at the crown of your head. This is also a very sensitive spot. You can gently massage it for relief. For some people, this point can be very painful. If it is very painful, you don't have to press hard. You can press gently. Additionally, you can also try to massage the point located right between your index finger and your thumb. This specific area is remarkably easy to find, and it is also rather sensitive to the touch. Be sure to thoroughly massage this point on your right and left hands alternately to get the full effect. These simple movements can help relieve your headache. But if you want to cure this pain, it can be treated in our clinic with acupuncture, osteopathy, or various types of massage, such as acupressure, myofascial massage, and so on. Tension headache is a problem of modern lifestyle and modern people, but it is a solvable problem and it can be resolved easily. You do not need to take a lot of painkillers, and you needn't to endure this pain or suffer from it any longer. Just relieve this pain and live your life. Enjoy it. The second type of pain I wanted to talk about is migraine. Migraine is a pain of moderate to high intensity. Migraine is It's a paroxysmal pain, sometimes occurring once a week or once a month. Migraine pain, unlike tension headache, depends on external stimuli such as physical activity, bright light, smells, stuffiness, and so on. External stimuli intensify migraines, vision worsens, blurriness, and so on can occur. Many people think that migraines cannot be cured. In reality, you can't do much to help yourself with migraines, except maybe by finding a dark, cool, quiet place to lie down and sleep. That might help just a little, but mostly this pain is very intense, making it impossible to fall asleep or calm down. If you suffer from frequent migraines, this pain can be effectively treated. It can be treated with acupuncture therapy. There's no need to endure this. You don't need to take painkillers. You need to treat the cause. It is specifically the methods of Eastern medicine, reflexotherapy, massage, and myofascial massage that are very effective and can completely cure these pains.